Back to that news from Moderna this afternoon, the company asking the FDA to clear low-dose vaccines for babies and toddlers.
Joining us right now to talk more about this news and the ongoing effort to vaccinate the youngest Americans is the Commissioner of the Department of Public Health, Dr. Manisha Juthani. Thanks so much for joining us today.
Thanks for having me.
All right, so vaccinating this age group is a serious medical need. They are the last age group to still need to be vaccinated. What do we know about the effectiveness of this two-dose lower regimen being proposed?
So we're waiting for the FDA to be able to fully review these data, but what we're hearing from Moderna is that a 2-vaccine dose regimen in this youngest age group that is a quarter of the dose that were administered to adults is producing robust immunity in our youngest children. And so one of the great things about this is that it gives parents another way to protect children and our youngest age group that has not been protected so far with vaccines.
Dr. Juthani, if a child has had COVID, is it still worth getting a young child vaccinated, even though the efficacy isn't quite as high for these lower doses as it would be for adults?
So actually what we're seeing is that the efficacy of this particular Moderna vaccine, again, by their report, is actually quite close to what you would get in an adult. And so that's what really needs to be reviewed. In terms of whether it is worthwhile for children who've had COVID to get vaccinated, really we need to see those data to know for sure. But what we've seen in other populations so far is that vaccination still has been the most consistent way to have more longstanding immunity that is more robust than natural infection in and of itself. So hopefully the same will prove to be true in our youngest children.
We also want to ask you about antiviral treatments that are out there. Who would be eligible to get that, and is it needed within 5 days of diagnosis?
So that is correct. In order to be eligible for these medications, you want to take them within 5 days of symptom onset. Additionally, our oldest citizens of the state, so people 65 and older, and those with other comorbid conditions, regardless of age, whether it be lung disease, heart disease, and the like. These are people who are going to be the most at risk for complications of COVID, and that's why getting evaluated should you get COVID to determine whether you're eligible and whether you have mild to moderate disease so that you can qualify for a medication is very important.
Commissioner of DPH here in Connecticut, Dr. Manisha Juthani. Dr. Juthani, we appreciate your time. Thanks.
Thanks for having me.